This medication is used to relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin thins and loosens mucus in the airways, clearing congestion and making breathing easier. Dextromethorphan reduces the urge to cough by acting on the cough center in the brain. If you are self-treating with this medication, be sure to read the package instructions carefully. Cough and cold products are not safe or effective for children younger than 6 years. Some products are not recommended for use in children younger than 12 years. Always follow dosage directions carefully to decrease the risk of serious side effects. Do not use this product to make a child sleepy, and do not give other cough and cold medication with similar ingredients. Ask your doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drop/spray. When taking Robafen DM cough, you can take it with or without food as directed by your doctor. If you are self-treating, make sure to follow all the directions on the product package. If you have any questions, it's important to ask your doctor or pharmacist. It's also important to drink plenty of fluids while taking this medication. This will help to break up mucus and clear congestion. The dosage of Robafen DM cough is based on your age, medical condition, and response to treatment. Make sure not to increase your dose or take this drug more often than directed. If you are using the liquid form of this medication, be sure to carefully measure the dose using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. For powder packets, empty the entire contents of the packet onto your tongue and swallow. And if you are taking the capsule form, simply swallow the capsule whole. It's important to not abuse this medication, as it may result in serious harm such as brain damage, seizure, or even death. Never increase your dose, take it more often, or use it for a longer time than directed. If your cough returns, or if it is accompanied by a headache that doesn't go away, fever, severe sore throat, rash, or if it lasts or gets worse after 7 days, make sure to tell your doctor. These symptoms may be signs of a serious medical problem. And if you think you may have a serious medical problem, it's important to get medical help right away. Some common side effects of Robafen DM cough include dizziness, drowsiness, nausea, and vomiting. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist promptly. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. While it is rare, a very serious allergic reaction to Robafen DM cough can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. As for the best time to take Robafen DM cough and the daily dosage, it is crucial to follow your doctor's instructions. If you have any concerns or questions about the medication, be sure to consult with your healthcare provider. Before taking Robafen DM cough, make sure to inform your doctor or pharmacist if you are allergic to Guaifenesin or Dextromethorphan, as this product may contain inactive ingredients that can cause allergic reactions. It's important to also disclose your medical history, especially if you have breathing problems, cough with blood or large amounts of mucus, or liver problems. This medication may cause dizziness or drowsiness, and using alcohol or marijuana can intensify these effects. It's recommended to avoid driving, using machinery, or doing tasks that require alertness until you can do so safely. If you have diabetes, liver disease, or any other condition that requires you to limit sugar or alcohol intake, consult your doctor or pharmacist before using the liquid forms of this product. Additionally, the liquid forms and powder packets of this medication may contain aspartame. If you have phenylketonuria, PKU, or any other condition that requires you to restrict aspartame intake, it's important to discuss this with your doctor or pharmacist before using the medication. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For pregnant women, Robafen DM cough should only be used when clearly needed, so it's essential to discuss the risks and benefits with your doctor. And if you are breastfeeding, consult your doctor before using this medication, as it is unclear whether Guaifenesin or Dextromethorphan passes into breast milk. It's important to be aware of how Robafen DM cough may interact with other medications you may be taking. This includes both prescription and non-prescription drugs, as well as herbal products. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential drug interactions. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Taking certain MAO inhibitors with this medication may cause a serious, possibly fatal, drug interaction, so it's important to avoid taking specific medications during treatment with Robafen DM cough. It's also essential to consult your doctor about when to start or stop taking this medication. It's also crucial to check the labels of all your medications to ensure you are not taking more than one product containing Guaifenesin or Dextromethorphan, as they are available in both prescription and non-prescription products. Additionally, Guaifenesin may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are using this drug. If you suspect an overdose and the person has severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow/shallow breathing, and seizures. If your doctor has prescribed Robafen DM cough, do not share it with others. It is important to attend all medical and lab appointments while taking this medication. If you forget to take a dose of Robafen DM cough, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the regular time. Do not take a double dose to make up for the missed one. When it comes to storing Robafen DM cough, it's important to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom and avoid freezing the liquid form of the medication. Different brands may have different storage needs, so it's best to check the product package for specific instructions or ask your pharmacist for guidance. Remember to keep all medications out of reach of children and pets. When it comes to disposing of Robafen DM cough, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.